Okay, we'll just get started now. So, welcome everyone. We're going to talk through the basics of ethics today. Which is going to be both myself and Kushi, as you said here. So, ethics is obviously very important. It's one of the core foundational fields in MMI prep. So, it can usually be tested as a standalone station, or it can be tested alongside other stations. You sort of get integrated stuff, which we'll touch on later. Also, I want to say I'm not ignoring you guys. I have my monitor with like the PowerPoint up here, so you're going to be looking over there quite a lot during this. So this is just a little introduction to who we are. We have all our aspects. We have our academy, which is to do with A levels. We don't want you to forget that part, as we'll talk about throughout this as well. Throughout this whole interview course series, we have to remember the importance of the interviews, but also balancing that alongside your A levels. Admission is obviously what we're doing now, and obviously schools we can get in touch with you guys and do more stuff in person. Please do let us know if any of this interests you. As we mentioned here, interviews, that's where we are exactly right now, but we don't want to forget about your A levels. Lots of people can pattern their interviews, but then forget about that aspect as well. So it's really important to balance both of those. But also, I just want you to take a moment to just remember about how much stuff you've come through so far. So, it's allegedly this is somewhat motivating. So, we'll take that. Today, we're going to talk through why ethics matters generally within the medical and dental field, some ethical content, how to apply this content, some practice questions, and then right at the end, we'll get to a Q&A and just round up all the key points. So this was a survey carried out by Medify to see how many universities had individual ethics stations. So at least 71% of the circuits for both medicine and dentistry last year had ethics stations. And then within that 29% that didn't would have had an integrated ethics station. So some examples of integrated ethics stations, sorry, could be like a role play where you have to see when to break confidentiality and when not to break it. Um, Sort of taking patients' histories and stuff like that. So there's a range of ethics stations that might not directly be, it wouldn't say outside this is going to test medical ethics. However, you need to have a general understanding of ethics for the large majority of the circuits you'll come through. So this is an ethical scenario. You're a junior doctor on the wards and have just spoken to a patient who refused life-saving treatment. What do you do? Obviously, this is hinted towards medicine. We'll have some dental scenarios later as well. But even if you are doing dentistry, you can still apply your GDC principles and stuff like that. So if anyone wants to unmute themselves and talk us through this process, or you want to put in the chat what you would do, I'll give you guys a few minutes to go through this. So if anyone does want to actually speak out the answer, then you can just put your hand up or anything. If not, then just put in the chat. We've seen some talks about capacity and competency in general, which is very good. We'll come on to them like a mark scheme a bit after. Try to understand why exactly. Need to ask the patient why they don't want the treatments. Yeah. Possibly beliefs. Yeah, that's something we can come on to with blood transfusions, which we'll touch on later. Pros and cons. Yeah. Explain the consequences. Perfect. So we do have the overall correct general idea in the sense that we want to check the patient for capacity to see if they can weigh up the pros and the cons of a decision and come to a conclusion. So we'll just talk through that a little bit. Whenever you have an ethical scenario, it's really important to specify that you understand that it's a difficult situation and that you would show empathy. So whether you get a role play scenario within your MMIs where they'll say this is a patient sitting opposite you, speak to them, then obviously you show empathy through the way you speak. You speak slowly, you make sure you maintain eye contact with the patient, stuff like that. However, if they're asking you to just talk through what you would do, then you'd have to specifically state it's a difficult situation to show empathy. Now, it might seem very obvious to you and me that it's a difficult situation, but they would just want the whole point of these MMIs is just to show them that you're a normal human being, because you don't want a doctor that can't speak, you don't want a dentist that can't speak. The bulk of your profession will be interacting with people, whether you're interacting with your peers, your colleagues, with patients, families, etc. So they just want to know that you'll be able to do that, which sounds very obvious, but it's just something they have to check. And that's just an easy point to score. So I graded quite a lot of the mock MMIs at Manchester. I've done 2 this year and I did 3 last year. And on all the ethical stations, if you state that it's a difficult situation and that you would show empathy, that's a tick. I'm not saying that's what the real MMIs will be like. It was through one of the societies. However, it's just a very important point to state. Today, we're going to talk through, because obviously you're quite early in your MMI prep. So we all sort of want to talk through a structure rather than getting all the concrete, all the information concrete in your head. So whenever you approach an ethical question, if you have a general overall structure of how to approach this question, you'll be able to apply them to a vast like array of scenarios, if that makes sense. So you'd acknowledge initially that it's a difficult situation that you'd show empathy, and then you'd walk through your 4 pillars of medical ethics, which Kushi will touch on later. So quite a lot of you talked about capacity. So that links in with the first pillar of autonomy, which is the idea that if a patient is deemed to have capacity, then they can make informed decisions about their healthcare. And the way that we test for capacity, which Kushi will touch on later, is that we ensure the patient can weigh up the pros and the cons of a decision, i.e. in this case to refuse life-saving treatment, can retain that information and then relay all that information back to you in a manner that makes sense. And that comes under the Mental Capacity Act. Then the balance of beneficence and non-beneficence. These are 2 pillars, 2 of the other pillars as well. So beneficence is the idea of doing good, so acting in the patient's best interest. And non-maleficence is the idea of do no harm, which is sort of the cornerstone of what everyone understands medical ethics to be. So these two obviously counteract each other because sometimes doing good for the patient can include inflicting a bit of harm to the patient. So if we need to take a blood sample from a patient, then obviously that's going to cause a bit of harm, injecting a needle into them. However, the benefit of that is higher, if that makes sense. So it's just balancing those two. And justice is the idea of just maintaining equitable healthcare for everyone. So in this sense, it would be that if a patient has autonomy, we use the same Mental Capacity Act for all the patients within the UK. So that would be justice in that sense, that everyone has the same equitable treatment. Then you make a conclusion. So while you're walking through your 4 pillars, you sort of give it as evidence. So you can sort of link to what you want to say, and you can give your own point of view, however you want it to be more evidence-based. In your conclusion, you can say what you think you should do, if that makes sense. So you want to be very objective throughout, and in your conclusion, you can use evidence to be a bit more subjective. Remember, as your role as a dentist and your role as a doctor is to educate patients. You don't tell them what to do. You use your medical knowledge and your dental understanding. You relay that information to the patients and allow them to make their own decision. If you question the patient's capacity, then obviously you escalate. You can escalate to an ethics panel. You can escalate to a senior colleague. And something else that's really important, if we can just go back, it mentions here that you're a junior doctor. If you're a medical student, your role will be different. If you were a dental student, your role will be different. If you're a trainee registrar, your role will be different. So just make sure you recognize the limits of your competence as well. So we're going to come on to why ethics is tested. As I mentioned in the beginning, ethics forms the foundation of healthcare. The idea that healthcare is autonomy driven, the patient drives the healthcare. In the past, you had more paternalistic healthcare where the doctor would just say, this is what you need to do. This is what the treatment we should give to the patient. Now, the role of the doctor and the dentist is to provide the patient with the healthcare knowledge that they need to then make their own decisions about their treatment. I touched on the beneficence, non-maleficence balance previously. That balance of doing good and not causing harm is really key to all ethical scenarios. Justice and equity. Justice is the main pillar, but obviously balancing that with equity, they're sort of linking together. Justice ensuring that everyone has the same access to healthcare, which obviously, as you go through your revision, as you probably know right now, there's the idea of a postcode lottery in the sense that certain areas of the UK will have access to higher quality healthcare as opposed to other areas. So that's another point to consider. And generally, ethical scenarios test your critical thinking and your application of knowledge. You can learn your 4 pillars. You can learn confidentiality. You can learn when to break it. You can learn when not to break it. But you have to be able to sit down within an MMI situation. You know you only have 4 to 5 minutes, and you have to be able to relay that information along to another person. And that's your ability to work under pressure. But also, you'll be given a scenario that possibly you haven't seen before, and you have to be able to apply that knowledge that you have to that scenario. So just the ability to work under pressure, the ability to think critically, and the foundations of general healthcare are the reasons that ethics are tested. I'll hand over to Kushi now to talk you through the 4 pillars.
Okay. So hi guys, I'm going to be talking about like the 4 pillars of medical ethics that Arjun just talked about. So what are the 4 pillars? So these are like pillars that guide all healthcare professionals. They sort of guide like the decisions that they make and also the actions that they will take for the patient. So the principle behind the 4 pillars is that they're very like patient-centered and they ensure like their safety and well-being. So it's a very like patient-first perspective that we're taking. So the first principle that we have is autonomy. So autonomy is sort of like the patient's choice to make decisions about their body. So it's their right to make informed decisions. So like as a role, as like a doctor or a dentist or any healthcare professional, it's like act as a facilitator. So you're sort of like providing the patient with the right information and guidance based on your expertise and medical knowledge, so they can then go on to make decisions about their like healthcare or their treatment that they're going to receive. So like to make like such decisions, patients should first have capacity. Does anyone know what capacity is? Can we put it in the chat, please? Or you can like speak out loud if you want. I'll give it a few minutes. Yeah, exactly. So it's the ability to make an informed decision. Very good, guys. Yeah, being able to retain and repeat information back. Very good. So it's a person's ability to understand, use, and weigh information, and then also be able to communicate that information to make a decision about their own care. So you would always like presume a patient has capacity unless there's like a reason to question it. Can anyone think of any like scenarios in which like a patient or a person could lack capacity? Yeah, good, like dementia. That could be a like a case. What else do we have? Alzheimer's, mental illness. Yep, unresponsive. Yep, mental disability, under the influence. Yep, very good. Yeah, their age, like if they're a baby, under drugs. Yep, very good, guys. So a person could lack capacity if they're intoxicated, if they have brain damage, severe learning disabilities, mental health conditions like bipolar disorder or schizophrenia. Um, so if like let's say a patient has capacity, you must respect their decision even if you disagree with it. So in cases where like a patient like refuses like life-saving treatment, as like a healthcare professional, you may disagree with that decision, but because like a patient has a right to like refuse treatment, you have to respect that decision. I think something else to consider is that autonomy like does not mean that a patient can demand or choose any particular treatment or like a scan as they wish. So it's not like a patient demanding it and then a healthcare professional like giving into their wishes. So you also have to consider like a physician's or like a doctor or dentist professional autonomy as well to only offer like a range of like clinically sound options. So you have to do what is best for the patient. So it's about like shared decision making on both sides, like the physician side and also like the patient side as well. So now we're going to move on to like the second pillar, which is beneficence. So beneficence is always like doing good or acting in the patient's best interest. So this is like a doctor or dentist's commitment to doing what is best for their patient and their well-being. So like sort of some questions you would think of when discussing beneficence is, will this option or will this treatment help the problem get resolved that the patient has come in within? Does the option fit in with all the patient's lifestyle and personal needs? So it's sort of about like considering why the patient has come in and tailoring it to the patient's individual circumstances. And you'd also consider if like the option or the treatment that you're giving is proportionate to the problem. So you don't want to like over prescribe, over treat something that could just be resolved on its own. So you have to consider that as well. Then moving on to like the third pillar. So this is non-maleficence. So this means like doing no harm. So once again, this is balancing it with beneficence, which is doing good, and non-maleficence, which is doing no harm. They sort of do go hand in hand with each other. So with non-maleficence, it's more about considering the benefits and then weighing against the potential risks. So the only time you would, for example, like continue with a treatment or like a solution or option for a patient is when like the benefits outweigh the risks. Those are like the only times you would go ahead with something. You don't want to give something that's more risky than like the potential harm it's going to give. And with something to consider with non-maleficence is like what are the associated risks with the intervention and what are the associated risks with like not giving that intervention. So you'd sort of like compare both sides of that. And then moving on to the fourth pillar, so this is justice. So justice is like ensuring like fairness. So this also like covers like the law and like the patient's rights that they have as well. So justice is also about like ensuring that no one is like unfairly like disadvantaged, and it's about giving like access to healthcare to like everyone who needs it. Um, and it's also like prioritization of certain patients. So in justice, you might talk about, for example, you have like an organ transplant, you'd prioritize certain patients who need it more like over others. Um, it's also like a public health also comes into this, so like about vaccines, about ensuring like everyone's safety and using resources fairly. So that's sort of what justice covers. Um, so I'm going to talk about confidentiality next. So can we ever break confidentiality? What do you guys think? You can put it in the chat, you can raise your hand, you can speak out loud, up to you guys. Yes, so
Maybe
in what cases? Sorry, did somebody say something? Yep, good. If the partner has HIV, if you're putting patients up, if the patient is at harm or others are at harm. Yep, if the patient has given consent, very good, guys. Yep, this is good. Okay, so confidentiality in practice. So what the good medical practice says, so doctors and healthcare professionals must keep patient information like private unless there are certain circumstances. So these circumstances are that the patient has given consent for their information to be shared. Um, Another like scenario in which you would break confidentiality is when not sharing it puts somebody else in danger or the patient themselves. So for example, I saw somebody talked about HIV in the chat. So if, for example, a patient has HIV and they're sexually active and they haven't told their partner, that's like a case where you would have to break confidentially and tell their partner because it puts them at risk. You could also break confidentiality if there's like a lack of capacity of the patient. And if you do like break confidentiality, you would break it disclosing minimal information. You would only disclose what is necessary with the people who it is necessary. Okay, so you wouldn't just go around telling everyone. You'd only tell like certain people like who are necessary to be like involved in the situation. And like a key word to use with this is like you would tell people on a need to know basis. So I think that's like a good like keyword to use when it comes to confidentiality scenarios. Um, and it's also about like just being honest with the patient as well that you are going to go ahead and break confidentiality. Okay. So the next scenario. So you're an ST5 pediatrician. Whilst reviewing your prescribed medications, you notice you've accidentally prescribed paracetamol for the wrong patient. What do you do? What do you guys think? You can put it in the chat. You can say it out loud. Yep. Yeah, very good. You'd notify the patient, you'd reflect, record the mistake immediately. Very good, guys. Okay. So let's just go through this. You'd be open and honest about when things go wrong. So like as doctors, as dentists, we have like a duty of candor. So candor basically means being honest even when things go wrong. So the reason why we be honest is because it respects patients' autonomy. It also like builds and maintains trust in the profession and the healthcare system. So for example, if you've made a mistake, you don't tell the patient, and if they find out, it does really break like the rapport between like a doctor and a patient. And also it builds like mistrust in the profession as well. So in order to like maintain that, it's important when we admit things go wrong. And it also facilitates learning and improvement. So it's important to reflect once mistakes have been made so you don't um like so you don't like this doesn't happen again, or we can put things in place to prevent things like this from happening. Okay. And you'd also consider like non-maleficence as well, the pillar we just talked about. So like for example, in this scenario, giving paracetamol isn't going to cause much harm unless like they're allergic to it, for example. But still, due to like the duty of candor we have as healthcare professionals, it's important to be honest and open about like why things go wrong. And yeah, so next scenario. So you are a dental student on placement and you notice that another student constantly shows up late and smells of alcohol before clinics. What do you do? What do you guys think? Put it in the chat. Yep, you can speak to them privately. Good. Yep, ask if they're all right, if they need any help. Anything else? Anything else? Yeah, outline potential consequences, notify someone if it's caused patients harm. Okay, good. Yeah, good. Showing empathy and compassion when speaking to them, that's really important. Okay, so the first thing with any scenarios like this is to first think about like prioritizing patient safety. That's like the most important thing to consider as doctors and dentists. So even if you're a student, being intoxicated on your placement, that is a risk to patient safety if you're speaking to them, if you're like involved in any hands-on procedures. So this would like compromise your ability to like practice safely, and that does put a patient at harm. So once again, we're considering non-maleficence as well. So I think the next thing to do would be to speak to the student privately. If I feel that it's like safe and appropriate, if I feel comfortable and confident speaking to them, then I would go and speak to them like privately in a non-confrontational manner with empathy and compassion. And I would confirm my concerns. So and then I would also like, I could then provide them with support, but I have to keep in mind what my limitations are as well. I'm also just a student, or like if I'm a junior doctor in any scenario, you have to consider your limitations and acting within like your role as well. So I'd offer like a realistic like solution. Like I could offer to like arrange for them to go home safely or provide a room while where they can rest. So that's something I can do within my like limitations. But if I'm not feeling comfortable like talking to them, or like if I just don't want to speak to them, I would then escalate the concern to a senior member of staff, and I would emphasize the risk to the patient and their safety, and I would also like document what has happened. So I think the important thing to bear in mind is even if you're not 100% confident that the person is intoxicated, even if like you're afraid there is a risk to patient safety, you would always escalate your concerns. Um, so yeah, that's the main thing. And you would also escalate in a sort of like private manner as well to like a senior member of staff or whoever your supervisor is.
Okay, thank you. I'll come back for the conclusion. So the main things that we really want to get across is that ethics is not about memorizing scenarios, because obviously you're going to get your liver transplant scenarios, which are very common. You're going to get patient as so you can get the HIV scenario as well about breaking confidentiality. You can get taking patient history. You can get a bunch of scenarios that are fairly common, but it's not about memorizing these scenarios. It's about learning your four pillars, about learning confidentiality, what it is, when to break it. It's about learning duty of candor, what it is, when to apply it, and being able to apply it to different scenarios. So we always say you need to revise, not rehearse. You revise, you need to learn your content, you need to learn how to apply it, but you shouldn't learn exact paragraphs of how to answer certain questions. Learn a structure for your ethics, even not so related to ethics, for your motivation for medicine or motivation for dentistry stations. Don't memorize why you want to do it. Be genuine, be honest with yourself. Have bullet points. We'll touch on this in the Q&A because some people have been worried about how to balance MMI revision with A levels. So we'll touch on some ways to do that. But when you're revising, don't rehearse what you want to say. Have a general structure, have some bullet points in your mind of what you want to say, and then let it flow together naturally. The right university will pick you. MMIs are made to fit that university. So if that university is the right place for you and you do the correct prep and you put yourself across as who you really are, you will end up in the right place. I hope that calms some nerves a little bit. Think about what you do in certain situations and also why you do it. A lot of people are happy to say, I'd rather give the liver to this person, but they won't state why, or they can't fully enunciate why they want to do this. So think about both sides. Don't just think about why you're doing something, think about what you did as well. So make sure you just have a balanced argument. And like I said, apply a generalized framework to all your questions to allow for some general understanding of what you're actually doing it for. Okay. Our WhatsApp community. So we'll do a Q&A after this. This is just a little bit of housekeeping, some extra stuff. I know quite a lot of people when they're going through their revision, they look online and they end up on the student room and they see a bunch of neeks that have got like 400 nines and like 15 A stars and they've done 6 degrees. And they're saying, oh, will I be eligible to get into university? That's not the point of this WhatsApp community. We actually have a bunch of mentors, we have a bunch of medical and dental students, and you have normal human beings that are going through what you're going through. So as much as you can get help from us, from the mentors in general, you can also get advice from people going through what you're going through that are actually normal. What's coming up next? We have another webinar next Sunday, I believe, on motivation and work experience and stuff like that. We have your journey to medicine and dentistry to sort of understand where you are and where you're going to go to from here, and launching some more aspects of the Mental Society. And I think I'm going to hand over to Kareem to talk about the interview guide, and then we'll have our Q&A panel afterwards as well.
All right, so hello everyone. Thank you, Arjun and Kushi, for such a wonderful webinar. So, for those of you who don't know, we've got our interview mastery course. Now, I don't want to plug it too much, but we've got for anyone who wants that extra support beyond the free webinars that we do in the free guides, we've also got our free guide coming out in the next sort of few days, hopefully, for interviews where you can practice questions, you can have a look at model answers and all that sort of thing. In addition to that, we've got our interview mastery course. So if it's something of interest, scan that QR code. You've got sort of 25 plus hours of lectures. You've got your own personal mentor that you can book 2 1-to-ones with. And that also includes a mock MMI, a 6 station mock MMI with lots of feedback. And we're trying our best to sort of also have uni specific groups. So if there's a particular uni you're interested in, do put it in on the form when you sign up. And yeah, it's supported by 4 out of 4 offer holders at a range of UK medical and dental schools. And we've had some from last year, all the people who were with us in the interview season, 95% got offers and made it to medical and dental school. So if you want to be part of the club, that's something that I'd advise you guys to sort of scan the QR code and join. You can find out more information on our WhatsApp community, on our Instagram, on our LinkedIn, on our website, if you want to join the course. But without further ado, just before we go on to the Q&A panel, we've added one more question, which is, should vaccination of children become mandatory? So a lot of you have answered in the chat like keyboard warriors, but we want to give you guys one small opportunity. If you want to have a go at this question live and get the feedback from Kushi and Arjun in terms of how you can refine your answer, and then we can all work together as a community to see what the answer did well in and what we can improve in. Speaking out loud, yeah, speaking out loud is the best way to practice. And what we found from the free webinars and the courses that we've done in the past is the students that engage the most, and you know who you are because you're still stuck with us ever since last year. The students that engage with us the most are the ones that typically get the offers for medical and dental school. So you have an opportunity here today before our Q&A panel where we can go over a lot of things to have a go at this question. Now, it doesn't matter if you flop it, but we all got to start somewhere. So, Ziad, do you want to have a go at
Yes,
answering
I
this
would.
question? Think about four ethical pillars. Think about which two might clash, like Kushi and Arjun were saying earlier. But have a go. Khalid as well has put his hand up. You can go second after Ziad, but Ziad, do you want to have a go?
Okay, should the vaccination of children become mandatory? I think no, because it should be up to the choice of the parent to decide if their child should receive the vaccination. But for example, on the other hand, if the vaccination for something like COVID and there was like one for like, say if there was like a disease like COVID that came again and a lot of people are getting infected and dying and the vaccination exists and there's a vaccination for the children especially, then they should take it because that's a life-threatening situation. But if it's for like general diseases such as like measles, which doesn't really happen, or malaria, it doesn't really happen in the UK, but other places in the world it might happen. So say if we're in the UK, yeah, there's no need, like it should be up to the parent if they decide or not. Yeah, that's my answer.
Okay, perfect. Thank you. So before we as the mentors give any feedback, does anyone in the chat want to say anything to Ziad?
لسه ابدا يا اما يبقى في ميزان حسنات او سيئات.
Mention it on refer to this. So I think initially it's very good. Well, firstly, thank you for putting your hands up. Secondly, I think you had a very clear answer, which is what quite a lot of people struggle with. So lots of people talk through their pillars, lots of people talk through everything, but they won't actually come to a conclusion. So you said very clearly in the beginning that it should not be mandatory, which is good. You touched on relevant examples. So you gave the example of COVID and possible future things. But I think in general, whenever you get a question, you should always take a few seconds or so. So can I have a few seconds to gather my thoughts and then sort of articulate your answer. So they're not allow you to be more structured. Does that help?
Thank you. Yeah.
Okay, perfect. Does anyone else want to answer? I can't see you made that hand. My laptop's glitching.
The first person or the second person lifting their hand up on the my thing is Khalid.
Okay, kind of
Yeah,
left
hello.
you, but yeah, go on.
Yeah, just give me 30 seconds just to write some stuff down now.
Cool.
Thank you. Okay, so should vaccination of children become mandatory? So before I start off, I'd like to state that there is two sides to this argument. I can see that there's beneficence and autonomy, the two ethical pillars that are clashing. I'd like to start off with beneficence, so the duty to do good. So the obvious good thing to do would be to obviously vaccinate the child because it would build immunity for diseases. It would possibly help the child to gain a a better life expectancy. They'll be able to live more longer. If the vaccine is for STDs, HIV, AIDS, for example, this could help the child with their life. They can have a better life, for example. And a fact that I would like to state is during COVID-19, the only reason that we got through that pandemic was due to vaccines. And so I think vaccines are a really important and useful method to get through pandemics and diseases and things like that. Now, moving on to autonomy, which is the self determination for an individual to make choices about their lifestyle or their health. This all depends on if the child is GILIC competent. So, if the child is under the age of 16, then they can't make decisions about, if the decision is life threatening, they can't make a decision about it. But if it's like a small vaccine or something that wouldn't really affect them, not do you mind if I just take a moment?
Yeah, of course, take your time. You'll have usually like 4 to 5 minutes within these stations. Obviously, it depends uni on uni. It can be 6, but you'll have a lot more time than you actually think you do.
Okay. Okay, so this would all depend on if the child is GILIC competent. So, can they retain information? Can they weigh the risks and benefits? And can they communicate their decision back to me clearly? So, and also, I would need to have a discussion with that child's parents if they are willing to have their child to take this vaccine. Another thing that I'd like to mention is there is sometimes some misconceptions about vaccines. For example, the MMR vaccine, um, what was it, around in the 90s, people thought that it was linked to autism. And that was a big misconception because it caused lots and lots of deaths due to that. And so I would need to have a chat with the parents or the child themselves to clear up any misconceptions and to see where we can go from there. But overall, I think that we should give vaccines to children, but overall, I think there should be a choice for the child and the parent. That's my answer.
That's perfect. Thank you. So you see, when you take a little bit of time to actually pause, you can sort of actually structure it in your head. So we've got another question after this. So everyone else who's raised their hand, we can go through that. But I just want to touch a bit more on structure because obviously there's a lot to cover in an ethics station. It depends on station to station. So if you can tell that it's clearly going to involve your 4 pillars of ethics, in your head, you should have a general idea of you should know what the 4 pillars are perfectly, which you will do as you go through. And then you'll be able to apply it to a certain amount of scenarios. So we'll touch this in the Q&A panel, how to prepare for ethical station, how to prepare for stations in general. So once you learn what your 4 pillars are, you can use ChatGPT, you can use pre-made question banks, you can use so many things and just apply those pillars so many times. So eventually, when you get a question like that, straight away in your head, you'll think, what are the 4 pillars? I know what the 4 pillars are. How do I apply it to this question? If you get a question that's mentioning confidentiality, then just think, what is confidentiality? When can I break it? Things like that. So you'll have that general structure. What are the 4 pillars? The 4 pillars are autonomy, beneficence, non-beneficence, and justice. Autonomy is the idea that if a patient can weigh up the pros and the cons of a healthcare decision, keep that information, i.e. retain it, and relay it back to a healthcare professional, then they're deemed to have autonomy because they can give informed consent. It's relevant to dental interviews as well. Yeah. So even though it's called medical ethics, it's still very important to dental interviews as well, because dentistry is a branch of medicine, even though it's taught separately. There's beneficence, which is the idea of doing good, acting in the patient's best interest. There's non-maleficence. You think maleficence means harm. Like, I think there's a Disney film about it or something. I'm not a huge Disney fan, but there you go. But non-maleficence is going to be not causing harm. And then justice is the idea that all healthcare needs to be equitable. So we have another question, but does that help at all, anyone with the structure? Does anyone have any more questions about how to structure ethical questions before we move on to the next question?
Yeah, do you have any feedback for the answer?
Yeah, so sorry. So with the answer in general, you talked through your 4 pillars perfectly, which is very good. That was very helpful. You touched on Gillet's competence and you touched on encouraging the parents opinion as well. But I think you said that we need to listen to the healthcare. Sorry, not listen to it. I think we should make it when we're talking about parents. We need to make it very clear that we wouldn't take the parents' word as like perfection. That's what we should follow. I think one of the key things that people trip up on when we have people under 16 is taking the parents' ideas as like exactly what we should treat them with, if that makes sense. So just make it very clear that although you would take in what the parents are thinking, if the patient is deemed to be Gillick competent, i.e., they're deemed to have autonomy, then you would take what the patient wants. Does that make sense?
Yeah.
Okay, perfect. Educating the parents. You would educate the parents as part of the healthcare decision if the child wants that. So the child would specify whether they want the parent there or they don't want the parent there. If the child is Gillick competent, i.e., they can weigh up the pros and the cons of a decision, keep the information and relay it back to you, then if they don't want the parents there, then that's completely up to them. If the parents ultimately say no, it's personal to give the vaccine. Yeah. So if the child is deemed to be Gillick competent, it's very important to understand this. If the child is deemed to be Gillick competent, then their decision, it will be the exact same as someone who's over 16. If they're deemed to have autonomy, then you take their decision as theirs. Okay, so we have some more questions to go through, I think. Do you agree with abortion? Okay. That's a very common one in general. So that's very nice to talk about your 4 pillars. So does anyone want to? I can see who's raised their hand. I can't see who's raised their hand. Okay.
It's
Kushi, can you
Mario.
see who's raised their
Mario,
hand?
do you want to have a go?
Mario. Yeah, go on.
Yeah, can you hear me?
Yeah, that's all good.
All right, so let me just get the 4 pillars up by name. Sorry, so I just don't forget them as I'm speaking.
No, of course, don't worry.
All right, so with abortion, I'd like to start off with autonomy. So wait, just a quick question. Do I have to give a definite answer if I agree or disagree, or can I give a balanced view?
You can give a balanced view, but it's asking, do you agree with abortion? So in the end, they want you
Okay.
to give you a specific
All
answer.
right,
Just
all
see
right,
how the
fair.
question's worded.
Okay, so I would start by saying I agree with abortion because if we start off by autonomy, I think it is ultimately up to a mother because it is at the end of the day her body, so she should have the correct autonomy to take her informed decisions. Obviously, that will go into non-malevolence and benevolence because you have to obviously look if she is competent or not to make such decisions. And if we are looking at it from the justice angle, we would have to say that I'm kind of blank on that one. So I'll come back to that one later. So, and then going back to benevolence, you also have to look at the analysis between how old is the fetus and the mother's age, the mother's risks. So if the mother is, let's say, a geriatric mother, then obviously an abortion would be favored in such circumstances because it would pose a greater risk to the mother. And in such situations where it is, it's not consensual, or if it was the pregnancy was not consensual, it was rape, then obviously the mother should also have the informed consent to be given an abortion. From the justice angle, that links to justice because it's, I don't know how to link it too well. But from just justice angle, it would have to be. I'm blank. I'm blank right now. That's all I can think of.
No, I thought it's fine. I remember when I was doing my interview prep, because I had 4 interviews, and probably up until like a week before, because I left my interview prep quite late, and I had all 4 of my interviews within a week and a half. So like, I remember when I first started like prepping for my interviews, I was really stressed and I couldn't think properly as well. So when you're going through your 4 pillars, if justice doesn't like specifically apply to a pillar, you don't need to use it. Is the 4 pillars is more of a guide rather than you have to use all 4 of them? So I think your talk through autonomy was very good. That if the mother can give informed consent, then it's her body, so it's her choice. So that's one viewpoint, obviously. Balancing the beneficence and non-maleficence. You're talking about the beneficence and non-maleficence of the mother, but what about the fetus as well? At what point does a fetus become a child? So that's something else you could discuss if that makes sense. But I understand justice doesn't hugely link to do you agree with abortion or not. Obviously, there can be the idea of like abortive technologies being easier to find within bigger cities and stuff like that, but that doesn't really answer to whether you agree with abortion. Justice more about like equitability, which sort of you can discuss during beneficence and non-beneficence. So it's sort of the idea that the pillars are quite interlinked and just use them as they suit you. Does that make sense?
Yeah, that makes sense. Thank you. And also,
Yeah,
just
perfect.
would you be allowed to make any notes during the interview? Like, would they give you a chance to not interview? Yeah, the interview, the multiple stations. Like, would you be given would you be allowed to take a piece of paper in with you or not?
Personally, I've never heard of that, but that might sound a bit like intimidating initially, but trust me, once you do enough scenarios, it'll just become second nature to go through this. So I can try and go through this question if that would help. Granted, it's been 2 years since I did my interview. 3 years? What? Oh, I'm old. I'll get mine. So you start off, the easiest thing to say is that this will be a very difficult scenario to go through. It's going to require a lot of empathy to talk to someone you would go through. But actually, to be fair, it's not saying you're talking to a patient, it's asking about you in general. So you can appreciate the complexity of the situation, say that it's obviously a very complicated issue and there's a range of viewpoints. So that allows you to be a bit more balanced. And also, there's a bit of waffle to give you more time to think about what you want to say. Autonomy, if the mother can weigh up the pros and the cons of a decision, relay that information back to you and retain it, then healthcare states that she should be able to abort the fetus. However, at what point does the fetus gain autonomy? Obviously, the fetus can't speak to you, but at what point do we consider that to be a human being? So that comes into beneficence, how it links in quite nicely. We're doing good for the mother, possibly if the fetus is if the pregnancy is dangerous to the mother, then the idea of non-maleficence, we don't want to cause harm to the mother, and beneficence, we want to do the best thing for the mother, then possibly that would argue for abortion. However, we can't fully follow non-maleficence by doing an abortion because that's going to cause some harm to the mother's body. There's no abortive technique that's pleasant. And alongside that, at what point do we count that fetus as a child? And we're calling maleficence to that if we count it as a child because we're aborting it. Justice doesn't fully link into this. And there's some other things you can look into as well with different theological viewpoints. I don't know how much people care about philosophy. I don't think it's that deep personally, but it's fully up to you if you want to look into this. Things like deontology, consequentialism. If I remember correctly, consequentialism is the consequences sort of justify the means. So you might say that the destroying of a fetus is immoral. However, if that fetus remained inside the mother, both the fetus and the mother would die. If that makes sense. So you can look into different viewpoints if you're struggling for scenarios, but usually there'll be follow-up questions within the station as well. So I remember someone else was asking how many questions can you have in an MMI station? It depends station on station, but there can be a range of follow-up questions. I remember the ones that I ran, there was like 3 to 4 follow-up questions, but with ethical stations, the follow-up questions tend to be answered as part of your main question, if that makes sense. So they can say, do you agree about abortion? And then there can be a follow-up question talking about could they mention duty of candor? Not really. With these ones, is more of like your 4 pillars, but you can get follow-up questions. So we had one previously, a station where you had to like draw something whilst it was being described to you, and then the follow-up question is why you're doing this task. So if they get you to do tasks with more follow-up questions, with ethics, there doesn't really tend to be too many follow-up questions, I don't feel, as long as you answer your question balancedly. So if you just give your 4 pillars without giving any judgment, they'll say, what do you think? That'll be a follow-up question. So like more of a prompting question. I think I waffled a bit there. I hope that was helpful in general. Does anyone else want to give this question an answer, even though I just gave like a modern answer? Could you mention sanctity of life? Yeah, you could, to be fair. Does anyone else want to give this an answer, or should we go on to the Q&A, which I kind of already like unofficially started? Okay, Q&A. So, do you recommend discussing advantages and disadvantages in the ethics scenario? In what way? What do you mean by advantages and disadvantages? Arguments for, arguments against. Yeah, exactly. It has to be balanced. So, in general, you'll be given a general viewpoint and you have to argue both sides. It's really important to show balance. As much as I say you have to give your opinion, you have to be very balanced as well. So you trying to give your opinion at the end. How do you plan out your interview prep? Overall, I don't think my interview prep was planned out the most incredibly. Maybe Kushi can take this one because I got my interview offers in like mid to late November, and I had my interviews like first week of January. So my interview prep was quite intense. I think you guys will be a bit more balanced than me, hopefully. Learn your contents. I can give you what I did, and I'll let Kushi speak as well. Learn like the general ideas of what you want to cover. Learn your 4 pillars. Learn your confidentiality. Learn how to structure things, how to reflect effectively for your work experience questions, and then apply it as much as you can. Practice will be the best way to do it. I didn't actually have like anyone else when I was applying, so I sort of applied by myself because I took a gap year. So I recorded myself, and it sounds really neaky to record yourself and watch it back, but it works. Believe me. And granted, I did feel like a neek, but it worked, so that's all that matters. You can use ChatGPT as well. So it has that AI feature. You can ask it to give you MMI stations and speak it out to you. And that helps because when you speak, you need to learn when to pause, what an awkward pause is, what an awkward pause isn't, how to react to certain scenarios. But yeah, Kushi, can you say how you've revised as well?
Yeah, so I think I spent like a few weeks, and each week I'd take like a certain like topic. So for example, one week I'd focus on reflecting on like my work experience, and like why I decided to apply to medicine. Like depending on just how I wanted to space out my interview prep. And I'll do like motivation for medicine, then spend some time researching all the medical ethics, then going over confidentiality, candor, consent, all of that, then reading over like the different cases that you have. Like the structure of the NHS. So like there are lots of like different topics that interviews focus on, like role play is another one. So I just spend like a few days or like take a topic like each week, and sort of like research that properly. And like Arjun said, like reflection is really important. So make sure you reflect on your work experience. You have examples of each like quality that like a doctor or like a healthcare or a dentist requires. And you're able to like speak about when you've demonstrated that. So that's just sort of how I did my interview prep. And I think the best practice is just like speaking to other people. So if you have like your friends, and if you can sort of do like a mock MMI with them and just be able to like verbalize your answers, I think it really helps you like build your confidence as well. And just like another point is, when you are doing like interview prep, make sure you don't like write down paragraphs and paragraphs, and like memorize off that. It's better to write down a few bullet points for answers that you're preparing, so it doesn't sound like rehearsed and it's like comes across more natural. So yeah, I think that's just my advice in terms of that.
Yeah, sure. Start your questions if you have any.
I think someone's just raised their hand.
Yeah.
Anabia, yeah.
Basically, it was to do with when you mentioned about if children should like mandatory get vaccinations, right? You said how you wouldn't exactly value the parents' decision too much, and
Yeah.
how it would be if the child's competent, right? But
Yeah.
isn't that a bit subjective? Sorry, I did join it a bit late though, so I'm not sure if you like mentioned how you would measure the competence of a child. But
Yeah.
most vaccines are given when they're really young, and like
Yeah.
in my opinion, right, and not a lot of children, like as a child, I would have been like really scared of like the injection itself. So you don't actually really know if the child's understanding it. And like I wasn't like I said, I wasn't really here at the start. But autonomy, right? How would you actually measure that for a child? Because let's say you're telling them something, they're just going to repeat it back to you. How do you know they've actually understood that? Because once again, they're a child. So
Yeah.
it's really subjective, in my opinion. Like one doctor could say, okay, yeah, this child's competent enough to make their own decision. But the other one might decide, like, okay, wait, no, it's not. So I don't know. It's just a bit, yeah. Like, why would you
Now,
not
of course.
consider the parents' decision as much?
Yep. So the point I was trying to make is there's a subtype of testing autonomy called Gillet's competence. And Gillet's competence is the way we test if a child can provide consent. So when we say a child, it's anyone 16 or under, isn't it? So if the child is assessed to have autonomy in the sense that they can retain the information, so you give them the information, you don't tell them what's good about it, you don't fully tell them what's good about it and what's bad about it. You give them enough knowledge and you see if they can evaluate that own information for themselves. So you would tell them, they have to tell you what's good about it, maybe if they accept the decision, or what's bad about accepting the decision, and then relay all that information back to you in their own words. And if a child's 3, 4, 5 years old, which is when obviously the bulk of vaccines occurs early into birth to prevent any sort of exacerbation of conditions, then it's very unlikely you're going to be able to do that. So what I was trying to say is that if a child is deemed to be Gillet competent, i.e., they are deemed to have perfect autonomy, then their say goes over the parents' say. And you wouldn't neglect the parents. It's not like the parents will come to you and you completely ignore them. You'd listen to them. However, if the child is deemed to have autonomy, so they're deemed to be Gillet competent, then their say goes above your say and it goes above the say of the parents. However, the bulk of children, when we say children and we think of vaccinations in general, we think children that are 2, 3, 4 years old, and they might be able to repeat words back to you, but you'd be able to tell that they can't weigh up the pros and cons efficiently. They can't evaluate effectively. They can't relay the information back to you in their own words without stumbling significantly. So that's the idea, that if the child is deemed to have that full autonomy, then we take their word as if it's an adult. However, we assess that autonomy in a different way as we would to an adult. An adult's assessed through general competence. However, the child is assessed through Gillet's competence, which is a bit more enhanced and a bit more thorough. Does that make sense?
Yeah, but then there was also one other thing that I wanted to ask. So, you know how you get like religious beliefs, like
Yeah.
some like the parents, they'd obviously understand what the pros and the cons are for the vaccine, and they may understand also that it's better for the child rather than worse. But sometimes parents are limited by some sort of religious belief or anything, and obviously that child can't consent for it because they aren't competent enough for it. So how would you go about that? Because the parents are basically, like, let's say the child is quite in need of the vaccine, like let's say there's another pandemic and it's very dangerous, and so they would need it, but the parents are saying no because of some sort of ingredient or something, and it just goes against their religious beliefs.
Yeah. So whenever you have a situation that's that complex, the first thing you should always do, like I always say, is accept as a complex situation. It sounds really stupid, and I keep saying it because it's a mark. It's a very easy mark to get. You can consult an ethics committee. So I know I'm a drink. You can always consult an ethics committee because they're a lot more educated on this stuff than we would be. We have a general understanding of competence and stuff like that. But you can consult an ethics committee. But in this sense, I think you're saying that we're assessing the child to be incompetent. So we look at the parents' opinion, but the parents are limiting themselves to a religious belief. Even though the child is deemed not to be competent, we can still ask the child if they would have that same religious belief. But obviously, we can't take their word as perfect. So in that situation, you would outline it balanced on both sides. You can say one side, one side people can argue like that we should give it to the child because it's in the child's best interest. However, the child is not deemed to have autonomy, so we'd have to consider the parents' point of view, consider carers' points of view, possibly consider your own point of view because obviously you are the healthcare provider. But ultimately, you would consult an ethics committee and you would gather all that information together, collate it, and then relay it back to the ethics committee, and they would help you come to that decision. Does that make sense?
Yeah, that was it. Thank you.
Perfect. Do we have any more questions?
I think something good to
What,
answer
sure.
is how do you balance your A-level preparation
Yeah, just about to say.
and interview preparation?
Oh, right, one sec. So when I applied like after year 13, so I didn't really have to balance my A-level prep. So I don't think I should be that helpful. But when we say quite a lot of people wanted like a number of how many hours to do, how many questions to do, and quite a lot of people did this at our UCAT course as well, saying like, how many hours of prep should I do a day? How many questions should I do a day? Do whatever you feel works for you. It sounds like such a useless thing to say and so cliche, but everyone is an individual and everyone's good at certain things. Some people will be better at reflection, some people will be better at looking logically at ethics and critical analysis. So understand where you are. Take like a genuine understanding. You can make a little table. What I did is I made a table of all the things I need to know: motivation for medicine, how to reflect on my work experience, how to reflect on my extracurriculars, how to walk through ethics and stuff like that. And I'll see what I'm good at, what I'm bad at, and I'll allocate more time to what I'm bad at and less time to what I'm good at, if that makes sense. But I think Kush will be more helpful, and maybe even Cream as well, like how to balance during A levels, because I didn't do it during my.
Yeah, I think like if you like the half-term holidays are a good time to spend on like doing a lot of interview prep during then. I know like Christmas is like a good time just before like interview season starts. So I spent a lot of time in like the Christmas holidays doing that. And in terms of like during when A levels, like when I'm revising during school, I would spend like some time on the weekend, like a few hours the weekend. Throughout the week, if I was just like getting tired of doing like normal schoolwork and like revision. So I just like it's quite interesting actually to read on like ethical topics or like different cases. So I kind of just enjoyed reading that. I wouldn't do a lot in the week. I would just, just read it like, and I just found it quite like interesting as well. But I think like weekends were when I did a lot of it. But it's like Arjun said, it's really like personal and up to you, how confident you feel in your interview prep. So yeah.
Yeah, thank you, Crew. Do you have any more questions about anything? It doesn't have to be ethics specifically. It can be about anything in general. What medical hot topics do we need to know? Um, you can get a list online. I don't think there's any specific hot topics that you need to know. None of them came up at my interviews. So my bad, I'm just losing my voice. None of them really came up at like my interviews. I remember learning about Charlie Gard. I remember learning about NHS like resource allocation. There's the very obvious ones like issues within the NHS. So like resource allocation, like things that you obviously see in the news and stuff. I could say you can look at the news. I remember I slated BBC Health in the past, but it might be quite useful for this. But just have a general idea of how to apply your 4 pillars. And usually if they give you a hot topic, they'll talk you through a bit about what it is. How do I deal with nerves? Um, I wasn't that nervous, to be honest. So I don't really know what to say. I think I was really nervous for my Manchester interview because that was my first choice. But when you go there, you see everyone else is very nervous as well. And I think I was very like objective with myself in the sense that I've done a lot of prep for this. I worked very hard to be here. They've selected me for a reason. I think once you get to interviews, you know that you're academically good enough. They don't care about your academics once you get to a certain point. Once you get to interviews, your UCAT and your A levels and everything, that's shown them that you're good enough to do this. They just want to know who you are as a person. So, in general, if you're comfortable in reflecting, you've done the right amount of prep, you'll be fine. When did you get your email saying you got an interview at Manchester? I think it was like mid-November, and then the offer came like 2 weeks after interview. But usually it's like 3 months you should wait after an offer. So we'll come on to interview offers fully later into the cycle. We don't need to stress too much about that. Any tips for online interviews? If you record yourself while practicing, it'll make it like a lot easier. Because I had one online interview as well, and I found it okay. I don't think it was that difficult. I don't think there's too much to stress about. If you revise effectively and you learn how to structure your answers effectively and you reflect effectively, should be fairly calm. Should your answers be definite? If it asks you to be definite, then obviously 100% be definite. But I think it's very good if they give you a general question, then you should give your point of view as well with the conclusion. I think it comes naturally in a conclusion, so you can talk balanced throughout, but you get to the end and you just say what you believe based on the evidence that you presented. So I think it's a natural ending to a conversation. How long was your invite after your interview? I got my offer 2 weeks after, but they usually give it like 3 to 4 months after. It's only because I scored in the top 5% of everyone they interviewed. So they usually give like really early offers to some people. And then the other ones come through like mid to late April to May. But the abortion question was meant to be definite. I believe so because it asked, do you agree with abortion? Or it asked, I can't remember what the exact question was. I can get it up. But I think it is very useful to be definite at times. But I think this question said, do you agree with abortion? So if it asks, do you agree with abortion, then you have to give an answer. Do you have any niche tips? I'm not too sure how to expand on that. What happens if you blank out and don't know what to say? You take a few seconds and just like gather yourself. I blanked out in my first interview because I remember my first interview, I had like a not very nice interviewer and he asked me about work experience and he said, are you sure? And that sort of threw me off guard and I blanked out a little bit. But gather yourself and when you do enough questions, I promise you, it doesn't sound that helpful now, but when you go through enough questions, eventually it'll just become second nature. It'll become like muscle memory to like say of what to say, how to structure it and stuff like that. Really specific, how long after your interview invite were your actual interviews? Oh, my bad. With Manchester, you could schedule it. I think with some of them you can schedule it. Some of them will just tell you a specific date. So it depends very much on the university you apply to. That would be a conscientious subject to a bit of a grey area for divided opinions. If they ask you to give a point of view, so if it says, do you agree with it? You would probably have to say it because that's part of answering the question. But if it doesn't specifically say it and you don't feel comfortable giving an answer, then yeah, sure. But if I was in your situation, I would personally give an answer because I think it becomes naturally as part of a conclusion. You really want to be conversational in your interviews because they want to see that you're a normal human being. They know that you're intelligent enough to be there. But you get people that are really intelligent, but they turn out to be neeks. And you don't want your doctor or dentist to be a neek because that's the worst possible scenario that could occur. You want them to be intelligent, you want them to be a nerd, but you don't want them to be a neek. You want to have a normal human being. You're going to be in people's most personal parts of their lives. They want you to be a conversational person. So I forgot what my point was, but I'm just I'm really passionate about not allowing neeks in. In reference to vaccines again, if the child or parent couldn't relate back to you, what would you go with what the parent says? No, not specifically. So you would go to an ethics panel, you would go to senior colleagues, you would gather as much information as you possibly can, and then you would gather all of that and then take that conclusion from the ethics panel because at that point it's out of your hands. You wouldn't be fully understanding what to do. You'd go to an expert for it. We'll take 2 more questions and then we'll wrap it up. Will the recording be shared? Yes, but surely that doesn't count as a question. Do they ask questions based on your personal statement? Yeah, it depends on the university, but some of them will use a personal statement. Some of them will use like a non-academic information form. So it'll be a separate form that they give out after your interview, which you probably should have got across by now. So But yeah, make sure you know your personal statement before going into your interviews, because they like to check if you are who you say you are and if you're able to reflect and stuff like that. Because your personal statement wasn't important in what you've actually done. It's about how you reflected on it and what you actually took away from it. Because all the scenarios and things you need to learn will occur within medicine or dentistry. Therefore, everything you've done before this is just to build you up to be the person you are. So it's about the traits you've taken away from it more than what's actually occurred. If you come across a conversation with confidence, is it better to know the content? Wait, sorry. If you come across as more conversational confident, it's better than knowing the content, or you need both. You need both equally. But I think if you're going to prioritize one, learning to be confident and conversational equally is important. So not equally is more important, because the content of everything you'll learn throughout dental and medical school will be taught to you. You want to be a likable person. I've graded so many MMIs. I've done probably about 7 to 8 now at Manchester, and I can remember all the students that came in first time that were very conversational, very confident. And I can remember that a year on now, which I think that's really important. I think we have to wrap it up now. So